Welcome back. When it comes to cancer, finding it early is important, and in order to do so, you must get regular recommended cancer screenings. So today, we are talking about the 6 most common ones and when you should be getting them. Joining me now is Dr. Zoe Larned, Medical Director for Ochsner's MD Anderson Cancer Center. Thank you so much for being here, Doctor.
Thank you for having me.
Yes, an oncologist, a medical director, all that is sitting on the couch right now, and I think a lot of people just were like, wait, what? I should be getting a cancer screening? Oh my goodness, I don't think I've ever had one before. Why should we be getting these screenings? It's a preventative measure, I was reading.
That's a great question, and I think the most important thing about cancer screening is understanding that the earlier we catch cancers, either in the precancerous stage or in the earliest form of the cancer, the better off the patient will be in terms of overall prognosis. So for me, in the job that I do, unfortunately, when cancers typically present on their own, it's usually later in the game because there's been a symptom. And that may mean more treatment is required, or it may be more challenging to cure. When you do screening, you're catching it perhaps before there even is a symptom, before you would even have a detection yourself that something's going wrong. And when you catch them in the earliest phase or before they even turn into true cancers, you're most likely to be able to take care of them with easier management and long-term cure.
It's so true, but say I'm perfectly healthy, I'm 28 years old. When I go and get my yearly checkup, should I ask my physician to do a cancer screening on me?
Yeah, so the most important thing is to, one, have a primary care physician. You want to establish a relationship with a primary care physician, and you want to carry that through your lifetime. I think a lot of younger people tend to think that going to the doctor is not as important, and it becomes more important as you get older and you start to have symptoms or problems of different things. But the truth of the matter is, it doesn't matter whether it's cancer or other health issues. If you go to the doctor and establish a regular rapport and relationship, you're checking for things that are risk factors for blood pressure and high blood sugar, and of course cancers as well. So relationships with doctors are very key, and then the doctors will guide you. They'll guide you based on your personal history. They'll guide you based on your family history. They'll guide you based on the guidelines for cancer screening and help you make sure you stay up to date.
All of those things are so important, especially if you have a family history. And today we're talking about the 6 most common. There are several cancer screenings. Take a look at your screens, everyone. Breast cancer screening, cervical, colorectal, lung, prostate, and skin. Let's start with our women. When should they be getting these type of screenings? What age?
So they vary a little bit. So for the cervical cancer screening, you start those on the younger side. So the cervical cancer screening should start at least by the age of 21, unless there's some additional risk factors. And you want to be pretty regular with those, at least every 3 years, at least into your 30s. And then depending on your health conditions, your other risk factors, they may space out a little bit more in your 30s and 40s. There may come a time in your life with the cervical screening that you don't require it anymore. But the key is to have a good established relationship with the gynecologist, even from a young age, even before you're sexually active and having children, so that you're having these conversations and knowing what the tests involve.
It's so true. And then when it comes to other different ones, if we can pop that back up so we can let people know, when it comes to getting a breast cancer screening around age 40 for women?
Yes, so the breast cancer screening guidelines for an average risk woman is to start your annual mammogram at 40. The mammograms are easier than they've ever been. The way that the technique is and the way that they have 3-dimensional imaging, for example, they can really detect things very early, including in a precancerous stage for many women. Now that's for the average woman. You want to get it starting at age 40, and you want to do it annually.
It's so important when it comes to colorectal, age 45, and then skin cancer. Come on, it's hot, y'all. The sun is out between ages 20 to 30. Now for men, prostate cancer, such a big topic, age 50.
So 50 is for the average risk male for prostate cancer. That test is very easy. It's a blood test called a prostate-specific antigen, and it's a test that you do annually with your physician. Now, there are risk factors that make that test potentially need to be done earlier. So for example, for African American males, they should start that screening at the age of 45.
Okay.
For men that have one first-degree relative with prostate cancer or other certain cancers, it may also be 45, and sometimes even earlier at age 40. Again, that's why it's so important to have a relationship with a primary care provider that can help guide you through your personal history and your family history to help tell you what the appropriate screening guideline for you is. Not everyone is average. Some people may need the test a little bit earlier, that doesn't mean you need to be scared. You need to look at it as an empowering thing to prevent you from getting cancer.
I completely agree. And you know, you all just celebrated a 1-year anniversary of the MD Anderson Cancer Center with Ochsner. Congratulations.
Thank you.
I think a lot of people might be scared, right? For like men, yes, prostate usually around age 50, skin cancer 20s and 30s, as well colorectal cancer around age 45 for men. Are needles involved with all of them? Like, what's so
all the tests
popular about them?
are different. I think for the colon cancer screening, that's really become a very interesting space.
You got to drink that stuff, right?
Well, that's one of the screening tests. So the colonoscopy is certainly the screening test that you want to do if there's potentially a polyp or an early finding that may need to be removed or checked out. Yes, for that one, you have to have a prep. I will say, having done it myself, the prep is better than it ever has been.
Okay, that's
good. You can do pills now, or the liquid tastes better. And if you're lucky and there's not much found, you don't have to repeat that test for 10 years. We do recommend that start at age 45 now, because we are finding colon cancers younger. And for patients that, again, have family history or certain environmental or genetic risk factors or conditions like inflammatory bowel disease, they're going to have to get their colonoscopies much earlier. But there are some additional screening tests for our patients that may be a little antsy about procedures. There are stool tests that can be done that detect early circulating DNA or detect blood that can assist us in knowing if you're maybe at a higher risk for a finding on that colonoscopy and may need to proceed.
Wow.
What's most exciting in that space is the FDA just approved a blood test. We're learning more about it. It may not be as sensitive for earlier stage cancers in the colon, but it is an important addition to, you know, all of the tools that we have to help screen and screen earlier. What I remind patients of is, one, have the discussion about what the screening may involve, because you may not really understand what the screening involves. You're likely to find it is not as bad as you think it is. Ooh. And you're also likely to find that it doesn't have as many risks as you think. People sometimes are afraid, am I going to get a lot of radiation exposure from that imaging test, or is there a risk for something to happen during that procedure? Going through it with your doctor will make you a lot more comfortable with proceeding with those screening tests.
It's good to know that they are adapting, and remember, at the end of the day, early detection is so important. Thank you, doctor, for being here. We really appreciate you. And look, everybody, if you have more questions about cancer screenings and what Ochsner's MD Anderson Cancer Center can do for you, log on to ochsner.org/cancer services. All right, stick with us, everybody. We'll be right back.